Sorry, it is now. We better start from the beginning again.
Yeah,
Do you want to who you are again, please? Sorry.
No, that's fine.
It's always going too well. Go on.
So I'm Chloe Alexander. I'm Policy and Campaigns Officer focusing on young carers and young adult carers, and my role is at Carers Trust.
You led on the report Invisible and in Distress. What are the essential headline findings?
The findings were driven by thousands of conversations with young carers and young adult carers that their mental health was often a real area they struggled in, and it had a real relationship to their caring role. We felt this wasn't very widely understood, and it was a really important point to raise awareness that young carers, the evidence suggests that they have high levels of mental health needs, that there's a relationship between their mental health and the stresses sometimes of their caring role. So we wanted to look at where the gaps were in services and where services were set up in a way that meant they were kind of putting up barriers for young carers so they couldn't access that support. For example, we found out that young adult carers, in a survey, 45% of them reported they had mental health problems. In another case, we find that young carers are 5 times more likely to report poor health when they're providing a high amount of care. So we know there's a problem there. We wanted to look at the detail of how services could easily just reach out to more young carers, or look at when they're providing services to young people who have mental health needs, maybe picking up caring as a hidden factor within that group.
In the course of producing this programme, we've spoken to a range of young carers, and in particular Fern, whose story we feature on this programme. And to her and others, what they're telling us is this is about professional attitudes, perhaps more than money.
We found a whole range of experiences that sometimes it was about lack of awareness, that there was maybe little understanding about the relationship between mental health and caring for young people. Also, maybe just some more steps that need to be made about building up joint working locally, so maybe the local young carers service working with the children's mental health services, just making sure that both mental health and caring are looked at together and support can be provided for both aspects of a young person's life. But also that young people could struggle to access mental health services, and they felt there might be long waiting lists or the services might not respond to them as individuals. So there was a feeling that those services were hard to reach.
In terms of the two acts, for the first time young carers were mentioned in law, and the onus was put on the local authority, and indeed there are other duties as well on others, which tend to try to take away the barrier of a young person having to speak to an adult about their situation. Yet young carers are telling us they're still struggling to talk to adults, as though that duty has never gone into practice. What's your view on that?
The new legislation, well, that's been in place for a year now, the Care Act and the Children and Families Act, built on existing rights that young carers had, but they took them a big step forward. And really importantly, they also required local authorities to think about the whole family and look at the needs of people who have care needs or support needs, so that sometimes where a young person is providing care that's having a negative impact on their mental health, that kind of caring role is looked at, not just the result, which might be their mental health. So when we're looking at the mental health of young carers, it's really important that we go back to that legislation that's trying to implement a whole family approach.
And in terms of the whole family approach, some have suggested to us that rather than having adult services and children's services, in fact, there should no longer be this, what they see as an artificial division in types of social work. And in fact, it's not about removing social workers, this is about making them all individually family social workers. So the artificial divide is taken away, another level of communication is taken away, some may see as unnecessary. Do you think that would help?
I think it would definitely help if all parts of the local authority are aware of their duties to identify and support young carers, to support their families, and also to prevent young carers taking on inappropriate and excessive caring roles. And that is set out clearly in the legislation, and there's also guidance for local authorities about how they can make sure that, however it's set up within their organisation, that for a young carer they have a positive experience, they're identified and responded to and supported no matter who they talk to.
But Professor Luke Clements tells us that if a local authority does not observe their duty under either act, that there's actually no penalty. So there's no incentive to actually get involved and fulfil their duties, especially if it's a local authority that's short of money, maybe?
I'm not sure I can really...
Okay, all right, no, that's fine. Just trying to think what other areas we want to go to.
Could I talk maybe
You didn't talk about the islands thing?
Yeah.
Yeah, so let me ask you a question about that. In your experience, is one local authority much the same as another?
There's such a range of different approaches and really different experiences that we hear about from young carers and young adult carers. In many cases they feel really well supported, in other cases there's a lot of frustration, and sometimes there isn't a feeling that they've had that option about the extent of their caring role or the support they need to kind of keep them going with it. I think that in many cases there are fantastic local organisations who have a real strong sense of what young carers need, what young adult carers need, how the whole family can be worked with. And with the work we're doing on mental health, what we're hoping is those kind of islands of really good practice can be connected up so much more with all those other organisations that maybe are providing services generally for young people but aren't aware so much of young carers, or in other cases they can just join up the good work they're doing so that there's more kind of access to support for young carers. They might get a referral to a mental health service they really need, or support for their family that would have a positive impact on their mental health.
Well, how do you get, because presumably if you have an event or a conference or a meeting, the good local authorities turn up to it, but the bad ones don't. How do you get to the ones who aren't doing the job?
I think it's a really interesting time when support is changing. There's so much going on that it's really interesting to find out what different local authorities are doing, and I think we're still finding out a lot about how local authorities are going to work with their new duties and how it's going to be implemented, and the ways that good practice can be shared. I think there's a lot still to learn.
So do you think, or to what extent, a year on from the two acts, do young carers perceive that not much has happened because maybe it takes longer to actually put it into practice than a year?
Well, the duties have been in place for a year. I hear about local services, what their experience is, an increasing number of young carers assessment. Those are the kind of anecdotes I hear. We're also really trying to make sure that young carers and young adult carers have information about their rights, because that's such an important part of making this really effective. So we're trying to get information to them about what they should expect from their local authority, and kind of breaking it down so they know what it should mean for them and what they should expect.
Can I just ask you, earlier on you mentioned conversations in relation to preparation of the report Invisible and in Distress. Are we talking, in Fern's words, real conversations between people, or more of an online conversation, more of a remote conversation?
It's been a real mix, and that's taken into account the reality of young carers' lives, young adult carers' lives. I've loved those opportunities where I've got to speak face-to-face with young carers and young adult carers, and over the course of the Time to be Heard project, which Carers Trust runs, which is making sure decision makers hear from young adult carers, we've spoken to thousands of young adult carers and heard from them directly at events, at discussion groups. They've directed our work. We've heard from them as, really full and really interesting conversations. On the other hand, it's important that we reach out online to young carers and young adult carers, because that might be the only way they can be part of that discussion. So I think a whole mix of different ways has been really valuable.
And if it's online, in an easy way to engage with the online system, presumably?
Yeah, making it accessible, that's really important.